Welcome back to Jersey Matters. I'm Larry Menti. Only 25% of the nation's nursing homes and assisted care facilities are confident that they'll be able to stay open another year after being devastated by the pandemic. This is according to a survey by the American Healthcare Association. The good news, however, is that isn't the case in New Jersey. Here's my interview with Andy Aronson, President and CEO of the American Healthcare Association in New Jersey. Sir, thank you so much for joining us today. A shock poll was out, a survey done by the American Healthcare Association and the National Center for Assisted Living. And I guess the headline of the survey was that only 25% of nursing homes and assisted care facilities are expected to last another year. Is that the case in New Jersey as well?
No, Larry, that's not the case. That poll, first of all, it was self-reported information by providers, and it was in the context of, are you going to last without assistance in the current state? So you have to remember that in this industry, we're coming off a pandemic that very seriously hit this industry, and occupancy rates are generally lower than they were pre-pandemic. And I think what providers were saying in that poll is if occupancy doesn't rebound and if we don't get continued financial support from states, remember that was a national poll, then we're going to have problems. But in New Jersey, what we're seeing is we have had some support from the state as far as an enhanced Medicaid rate. We have gotten some support from the federal government financially, and we are seeing occupancy rates tick up in our facilities. So no, it's not nearly as dire as that report would suggest.
So you're not saying it's dire in New Jersey, but are there facilities that aren't going to make it?
I think generally in this industry, what you're seeing is consolidation of providers. So I think those freestanding providers that used to exist, the mom and pop facilities we used to call them in this industry, I think are having a very hard time making it. And I think what you're seeing is more and more, we call them multi-facility chains, regional chains, are acquiring those smaller facilities. So in New Jersey, what we've seen, particularly in the nonprofit world, is those small nonprofit facilities are having trouble making ends meet in the current climate.
I'll tell you what, your demeanor is very comforting. I mean, when you read the national survey, you'd think things are dire, but are you saying that people may be saying it's worse than it is in hopes of getting more federal money or state money?
Well, first of all, it's a national poll that we're dealing with, right? So it could be different in other states than it is here. I don't want people in nursing homes or families of people that have relatives in nursing homes or assisted living thinking that their facilities are going to close down or that facilities are going to be closing doors. That's not what's going on here. We're not going to see wholesale closures or anything like that. What we've seen in New Jersey is for those facilities that have had a hard time making ends meet and have closed down, there's been another provider who's come in and purchased that facility and kept the facility open. So I don't want to give the impression for people, to scare them when they're in a facility or they have loved ones in a facility that, oh my God, that facility is going to close down and I'm not going to have a place for my loved one. And that's not going to happen.
Nursing homes and long care facilities, even if they are going to be able to survive, at the very least, they took a hit in public relations, in their image during the pandemic. In New York, that's all that people talked about. In New Jersey, that's what people talked about. Has that had an effect?
Oh, absolutely. There's no question it's had an effect. Occupancy rates went from, in New Jersey, pre-pandemic occupancy rates were about 86% in facilities. I think at the lowest point, we were talking maybe about 61% occupied in New Jersey. So it had a huge impact. The whole shutdown during the pandemic, the new infection control standards, of course, the finances of having to deal with testing and PPE and all the other things we had to deal with, the lower occupancy rates, it had a huge impact on the industry.
And it's still happening. You said there's been a slight uptick, but you're nowhere near the rates you had before.
No, we're still not at the occupancy rates there were before. I mean, it's definitely having an effect on the industry. No question about it. The industry has not rebounded to the point where it was before the pandemic. And frankly, Larry, there are changes that are going to be permanent in this industry. A lot of the infection control policies and standards facilities have put in place to protect residents from COVID are going to remain in place. So I'll just give you one example. So when somebody comes into a facility at this point, they're put in a private room and quarantined for 14 days, basically. That in and of itself, you have to have the private room in the facility to bring somebody in. You have to quarantine them for 14 days. That in and of itself is not going to allow facilities to occupy, maximum capacity because of those types of policies that are in place to protect residents from the virus. So those types of things are ongoing, and they're probably going to continue well into the future.
Did any of the rules and regulations early on hurt nursing homes, made it more difficult to deal with the pandemic?
So I think the best way to answer that is people didn't know what they were dealing with early on with this pandemic. So in New Jersey, all I can really speak to is New Jersey. The policy, the public policy, the public health policy really focused on hospitals in New Jersey and how do we protect hospitals from being overburdened from this pandemic. And that overall policy, it had a negative impact on the post-acute providers, the long-term care providers, the assisted living providers, because we found that hospitals weren't ready to take our patients, for example. Hospitals were very worried about overcrowding. So when you had an elderly, compromised, frail person in a nursing home that perhaps was showing symptoms of COVID, the hospital wasn't so excited about taking that transfer. Instead, they wanted to maintain space for people from the community. So the idea would have been, treat the person in place. So there was a lot that happened during the pandemic that was very difficult for nursing homes. It made it a lot harder for our providers to operate during that time. But a lot of that is looking back on it now with perfect 2020 hindsight, right? We didn't know what we were dealing with. We didn't have testing. We didn't have a lot of the PPE that was necessary. We didn't have a lot of just the knowledge of what we were dealing with.
To your point, I heard someone describe dealing early on in the pandemic like it's trying to build a parachute as you're falling from a plane. I mean, you're trying to catch up. A lot of it was guesswork early on and mistakes would be made. But I guess the hope is that we've learned from those mistakes and that, God forbid it were to happen again, we're ready.
Yeah, very much so. Early on in this pandemic, we didn't know what we were dealing with. If you remember, the early guidance that came out from the CDC and the federal government, masks were not required, right? We were doing everything based upon symptoms. There was no testing. So everything we were doing was based upon symptomatic carriers, right? So we would screen our staff when they came in the building. You would look for temperature, you would look for cough, you would look for any kind of symptoms of COVID. But we now know that a significant percentage of the people that carry COVID are asymptomatic. So even if we were doing, everything symptom-based, cohorting in facilities, which is separating residents based upon their condition, was done based upon symptoms. Symptom-based approaches for this virus weren't going to be effective. And all of the early guidance was based upon symptoms. Obviously, we've learned so much since that time, and now we have testing. Obviously, we have vaccines, we have better treatments. We're in such a better place now than we were before.
Yeah, I'll just leave it with on a positive note, because you seemed positive at the top, even though you had this survey that was so horrible. So you're pretty confident that the industry and most nursing homes and most long care facilities are going to be fine because of government money and consolidation?
Yeah, absolutely. I think the facilities are going to be fine. There's going to be changes in the industry. There's going to be evolution in the industry. But yes, your facility where your loved one is, your facility where you're looking to place your person is not going to close down tomorrow. And nobody should look at the results of that survey thinking that, oh my God, the facility around the corner is ultimately going to close down.
Wonderful. Thank you so much for your time.
All right. Thank you, Larry.
Andy Aronson, president of the Healthcare Association in New Jersey. Next on Jersey Matters, a record number of kids are getting injured playing sports or just playing outside. We'll talk about it next.